We've heard many times that fair skin is healthy. In all fairness, fair skin has nothing to do with healthy skin.
This may sound shallow, but I haven't said this. Studies that more attractive people are more prone to getting better jobs, better placements, better pays than their counterparts, better partners, and so on. So this unfair advantage that attractive people have.
Your next skincare ritual begins with your lifestyle. Why? Because there are enough number of rituals being told, or routine skincare routines being told. Korea routine, Kodambakam routine, whatever routine you follow, whatever those, they are not going to help. Unless you treat it from inner, it is inner engineering, you call that word.
There are various procedures, but we are often made to believe that one cream can remove the scars, and we end up spending on creams. Let me tell you here that no cream actually works for scars, because scars are defects in the deeper layers of the skin, so you will need procedures.
Facial yoga is in trend now. Is it going to firm the skin or is it going to worsen the elasticity?
One thing I am sure, it will bring down your bank balance, but I will explain.
Please do not think that you need to be in the sunlight or take a sun bath for getting vitamin D. There are easier ways to do that. Where it is necessary, science-based, evidence-based, and if your doctor feels to take, not by trends, not by reels, not by shorts seen on WhatsApp University or Google University.
So ladies and gentlemen, when we talk about aging gracefully, we often forget the science behind our skin. Dr. VenugopalReddy is here to change that. A respected name in cosmetic dermatology, he blends medical science with day-to-day skincare in a way that's both practical and transformative. With years and years of experience helping people feel confident in their own skin, he is here today to share insights on aging, skin health, and what true outer radiance looks like. So yes, we are about to welcome the ever-elegant and enlightening Dr. VenugopalReddy on stage.
The agenda is to talk about all these, but let me make it short. The starters are introduction and some crispy starters with common myths. The main course is cellular inflammation, and the dessert is supplements and the care protocols. So everyone are looking good and also feeling good. All are dressed up well, and so you have your better confidence, your productivity is going to be good. This is all about skin. Skin is the largest organ. Vascular colleagues always say that their system is longer or better or complex. I partly agree with it because they are competing much more than us. But the skin is, being the largest organ, it reflects what happens inside. So more so of inner engineering, the common word that is used now, you need to treat from inside. I agree that there is a role for topicals in ageless beauty, but most of it is from inside and by lifestyle medicine. So these are the common myths. We've heard many times that fair skin is healthy. In all fairness, fair skin has nothing to do with healthy skin. Fair skin just means that you have the same number of melanocytes, that is the pigment cells, like any dark skin or brown skin person, but only the pigment inside it is lesser. That has nothing to do with a healthy skin. It's very common to see advertisements where they say it's all natural. I have naturals, Mr. Kumaravel. There's nothing to do with that natural. So here we have natural products are always safe. No, not necessarily. We need to understand natural products also have natural chemicals. The synthetic chemicals that are there and natural chemicals both can cause allergy. I'm not saying natural products are always a problem, but you cannot equate it into 100% being safe. That's only an advertisement gimmick. Skin problems are only skin deep and always contagious. Not at all. Skin can be a mirror of internal milieu. So skin is connected with systemic conditions. Many of the skin conditions are actually something to do with the systemic problems that are manifested on the skin. There are very few contagious skin conditions actually. Most of the skin conditions are non-contagious, and for that matter even non-infectious. Once you have a skin disease, it's for lifetime. This is so very common with my batchmates when they say once you're a skin doctor, yes, your patient is going to be transferred to the next generation, maybe your son or daughter. It is not true. All branches in medicine have conditions where you cure few at least and you control many of it. That's the same with skin also. But fortunately, we have excellent set of medicines, and with lifestyle medicine, we have much more cure than many other departments. Hair is deeply personal. You might have seen many advertisements where even without hair, that is also deeply personal. But you should understand that even though we are all very keen on about hair, the body does not consider hair to be very essential during stress. What happens is deprioritizes it, and illness, nutrition deficiency, and stress definitely damage hair. So washing hair daily will cause hair loss. It's very common. We've heard this. There is no reason why you should not take a hair wash daily. Actually, this question of hair wash, washing refers to the whole body, including the hair on the scalp. So you need to ideally wash daily. Hair grows faster if you trim or shave. Nothing to do with it. Hair growth is not related to how you cut or trim. It is related to the hair follicle. So that is not done with your trimming or shaving. So hair follicle growth is something from inner again. Oiling stops hair fall. Not at all. It's very common. We hear this for ages that oiling, he doesn't use oil, so he's having a lot of hair loss. We are confronted with some truth here. Oiling has nothing to do with hair fall. The reason being, skin requires a particular size of molecule to penetrate it. It is not so easy. Skin is not gulab jamun or rasagulla. Wherever, whatever you put on the skin to enter, there is a finite Dalton theory where there is a particular size of molecule, only that size can penetrate. That is one factor. There are so many other factors. That's why it is not very easy to deliver drugs through the skin, like a transdermal patch. There is a lot of science on that. Nails. We commonly see white spots and people keep saying, including physicians say it is a calcium deficiency. That's a myth. There's nothing to do with calcium deficiency in that. It's just minor traumas there. And you can see the other one on the other end, a line of black pigmentation. We have at times emergencies like this, meaning pseudo-emergencies. They see something on the net, they get worried, they come crying because they have thought the one with the line, you can see a black line, to be something called a dangerous skin cancer called melanoma. Whereas the toenail that you see, which is completely pigmented, that is a melanoma. So when you see, you know it's a difference there. But on the net, someone has put up that pigmentation in the nail, you should not miss on a melanoma, and then you will survive only for 6 months or so. So they come crying for no reason. This is the main cause. Cellular inflammation. Even though I'm talking about dermatology, let's understand that cellular inflammation is for all organs. This is the baseline for treatment, because whatever the triggers are, yes, lifestyle medicine will help in controlling the triggers or diminishing the triggers, all said and done. When it comes to cellular inflammation, what are we going to do? Yes, pharmacologically, there are drugs that we give. But the idea is, supplements should be used when there is a gap between the modern lifestyle and the drugs that you're taking. There is a gap. That needed gap will be fulfilled by supplements. I am the example for having used a supplement for my cardiovascular condition, and I would vouch for it. Cellular inflammation is like a silent fire beneath the skin. So what is cellular inflammation? This is for skin-wise, but the same is true for other organs also. It is a localized immune response. Whichever organ it is a localized immune response. For the skin, it is a SALT, meaning skin-associated lymphoid tissue. That is the keratinocytes, Langerhans cells, mast cells, T cells. Now, what are the triggers? The triggers are all that you never took today. For example, the diet. Your diet today did not have any trigger. Poor diet with high sugars and trans fats, not at all allowed. UV radiation, pollution, stress hormones, gut dysbiosis. Yes, but the next speaker will be talking more about it. I want to ask a question. What is GALT? GALT. 70% of the body's immune system resides in the gut. So it is very, very important to take care of the gut. There is a gut, brain, skin axis. Please read more about it to know. A healthy gut may be the most underrated skin care secret. So what you eat, all are important. Gut dysbiosis will cause production of substance called LPS. Those are lipopolysaccharides, which are harmful gut bacteria. This will trigger inflammation. Inflammation can be in the skin, it can be in any organ, it could be pancreas, it could be liver. Each organ will get affected by this. So we, in medical terms, when we use, for example, if you say hepatitis, The itis refers to inflammation. Pancreatitis, itis is again inflammation. So it is so common that you have an inflammation due to various reasons. And the baseline is you need to treat inflammation. That is where supplements will help. Cellular inflammation. After all this, please don't think that cellular inflammation is a bad word. Cellular inflammation, it is important that we have inflammation. Without inflammation, you will not be able to fight infection, you will not be able to heal the wound properly, or the skin barrier will not be fine. Same is to remove the damaged cells also, you need inflammation. These are all good, that's why body has it. But when is it a problem? It is a problem when inflammation is not required and you have inflammation. That is one. Second, when it is chronic. Third, when it causes problem after an inflammation in the skin, for example, if it causes fibrosis or scarring, it is a problem. The same can happen into the liver. That is when cirrhosis happens. Triggering autoimmunity. Autoimmunity can affect any organ. Again, the baseline is unwanted inflammation, chronic inflammation, dysregulated inflammation. All of these things, skin-wise, it contributes to aging and dullness. So that's why I'm talking more cellular inflammation as the main cause. Cellular inflammation will not be seen like a rash on the skin immediately. It is silent killer. It goes on for some time and then throws up the problem later on. But the earlier you catch, the earlier you quench the fire, the best is for the results for you. So don't wait till the problem comes up. You need to be proactive. Because all these, both the supplements take time to work, inflammation also takes time to work. Only when it is acute, you will land up in an emergency. But till then, the problem goes on. During inflammation, oxidative stress happens. This is equal to rusting of the cells. There are certain products called AGEs which are produced during this process. They are called advanced glycation end products. Cytokines, TNF-alpha, IL-6, all these will cause problems onto the skin. Similarly, they also cause problems in other organs. As I told you, supplements are meant to quench the flame. Supplements are for wellness. See, there is a problem. When you have wellness, when you take supplements, it prevents you to go into illness. But when you have illness, and then you're getting treated by the doctor, yes, supplements will again help you to bring back to wellness. So either ways, it stands between to help. So you should learn to choose appropriately, not that you need to pop up all the supplements in the world. What is a supplement? Supplements are products intended to add nutritional value to the diet or support specific physiological functions. That's very clear. But then you need to understand, I don't take this food, so I'll take a supplement. That's not right. Food is medicine. Whenever there is a deficiency, like when you test, that's where we say that it's written down there. You need to first test, identify if you have a need to take it, and then treat. After you treat, retest to find out if it is correct. If it is still not correct, give what next you should do. And then you will find that you are in the right direction. So you heal. So that is how you should do. So you need to follow clinical need, lab markers, or have preventive goals. Like Simran was saying, see, what is normal is different. But health-wise, you should not think of normal. You should think of being in the optimum health, at the pink of health. That's where it is important. There is no compromise on health. Unless you want to compromise your health span, lifespan, you want to die early, those are different. Anti-inflammatory supplements. See, why I'm telling it is anti-inflammatory supplements is, all these supplements help in inflammation. That is the baseline. Without this, nothing works. As far as I'm concerned, as a dermatologist, I use omega-3 because it improves the skin barrier. It is useful in most of the skin conditions because inflammation is there. Wherever there is an inflammatory skin disorder, I put omega-3. Optimum dose of omega-3 is up to 4 grams. And the EPA-DHA ratio should be fine with that. But then if you're taking for cardiology-wise, for heart patients, EPA is better. I take EPA now. Curcumin and with piperidine. So that is important because white piperidine, helps in curcumin absorption. So there are a lot of brands. We need to see, you need to read properly to know what is right for you. Because there should be a technology called BCM technology where 95% of the curcumin that you take should be into the blood. So that is when it works. There is a myth. Many people think, okay, I'm taking turmeric. Turmeric contains curcumin, so that is enough. So I take just a pinch of turmeric daily in the morning with milk. Again, milk is inflammatory, should not be taken. It is like mixing whiskey with soda. Doesn't help. Then comes curcumin. The amount that you get out of turmeric is very little. 1 kilo of pure turmeric powder gives you only a double digit of curcumin. And if you're buying the masala powders will have turmeric. Don't get fooled by it. There is no mention of how much curcumin is there in that. Already the curcumin would have been extracted. My doubt is that it had already been sold to pharmaceutical companies to make curcumin. So what you may be eating actually will be only turmeric powder for the flavor of it. Vitamin D3. Again, it is known to be a cofactor for more than 100 enzymatic reactions. Vitamin D3 has taken a center stage a decade ago itself. Vitamin D3 for everything, like we had zinc for everything. But then, when you do a lab test, vitamin D3 of 30 and above is mentioned as normal in most of the lab tests. But please do not go by that. You need optimum. There is no question of normal range. Normal range, Indian can live from 50 to 65. Would you like to be in that, or would you like to be more? Like that, this problem here is vitamin D3 should be optimum, where I would prefer to call above 60. Most of us who are indoors will not have it. And even if you are outdoors, Indian skin does not manufacture as much vitamin D3 as the European. We have a problem in the manufacturing of vitamin D on our skin. So the best way that you could take, if you're taking eggs, yes, egg yolk has vitamin D3. Of course, even avocados can help. Because it's a fat-soluble vitamin, you will get only from fats. Magnesium. Magnesium is very underrated. Nowadays, it's coming up more often. Aiwo has magnesium with magnesium and vitamin D3 together. But then, what next you should have is vitamin K2, MK7, which Aiwo has. And here, why this is important? Because even if you take vitamin D3, calcium is also getting absorbed. But then, calcium should be deposited in the bone and not in the blood vessels. Now, what this K2, MK7 does is, this MK7 form, it will help in pushing this to the bone and preventing depositing in the blood vessels. That's where that helps. Magnesium, probiotics, of course, for the gut, skin, brain axis. Supplements for the skin. The other supplements, this is all very well known by most practitioners use this. Zinc, biotin, selenium, collagen peptides, and glutathione boosters. Biotin is helpful for hair, but if you have a deficiency of biotin, not just every patient requires biotin, and it's not a panacea for all hair disorders. But for want of a product, they give biotin, which is actually harmless. But then glutathione is what everyone talks about. Glutathione primarily was used for, again, for the liver, for NASH, or for non-alcoholic fatty liver disease. But then it has been used more off-label by dermatologists and by every other person in the world, any other specialty, who is practicing dermatology and not still a dermatologist. They also use it left, right, and center. But the problem is, when you take oral glutathione, it doesn't work. Why? Because the gastric acid destroys it. It needs to be made in a particular technology, a Japanese technology, for it to be available. But the best way is to take IV. But it is not free from reactions. There are patients who have got admitted in emergency with breathlessness because of an angioedema after glutathione. Decade-specific skincare protocols. Look at the beauty. It's all beautiful all through. It's all in the eyes of the person who's seeing it. At teens, 20s, 30s, 40s, it doesn't matter. You need to age gracefully. Don't expect a 40-year-old to look like a teen. It will not be good. It is not what you are expected to be. It's all in your mind. You need to decide how you should be. It is your choice, however you want to be. But then, you should be careful about overdoing things. That is where problem lands up. My colleague and friend, Dr. Shraddha, will talk more about it. So, decade-specific. Why decade-specific? Every decade has its reason. For example, a teen's concern will be about oily skin, pimples, or seborrheic dermatitis, which is dandruff. But in the 20s, the reasons will be different. It could be post-acne care also. Skin does not age overnight. That's why you need to take it in decade-wise. Each decade brings unique hormonal and lifestyle shift. Yes. Collagen drops 1% every year by age 25. And by 50 years, 30% of collagen is already lost. So after menopause, 50% of hair thinning occurs, in the crown area in particular. So this is the tabular column. But if you look at this, you will see that, as I told you, oil, acne control, you need to bring in sun protection. Sunscreens are very, very important. That's one thing I consistently tell to all patients for whom either because of their skin condition or because of the medicine I'm giving, where certain medicines can cause sun sensitivity, I would definitely go with a sunscreen with SPF 50, mineral, chemical sunscreens, whatever, and the patient's choice of using what they want to. Niacinamide serum, yes, it helps. And then vitamin C in 20s, retinol in 30s. But please understand, it doesn't mean that in 30s you need to reuse retinol and forget about vitamin C or niacinamide. No, it adds up. So every 10 years, you are seeing that something is getting added. For example, with niacinamide, you need to take vitamin C for 20s, and in retinol, when you use 30s, retinol you need to take along with all of these things. And then 40s, hydration, azelaic acid, all said and done were fine. In the 50s, sensitivity begins. More, because when the skin is dry, the estrogen has taken its activity, there are a lot of reactions that can happen even then, because most of the hair dye allergies are also late onset. So with this, I would like to summarize. I have talked about more about the myths, the cellular inflammation, the decade-specific protocols, supplements, why, what, and when, and that's the 3-tier skin health support. See, baseline, all said and done, is inflammatory, food, stress control, gut health, sunlight exposure being limited. Please do not think that you need to be in the sunlight or take a sun bath for getting vitamin D. There are easier ways to do that. Then targeted supplements, where it is necessary, science-based, evidence-based, and if your doctor feels to take, not by trends, not by reels, not by shorts seen on WhatsApp University or Google University. Start treating the cause. Let's treat the root cause, not just the surface. Being a dermatologist, I'm telling, don't treat the surface or the skin-wise. Please go deep, dig deep. You'll find out what the truth is. Your next skincare ritual begins with your lifestyle. Why? Because there are enough number of rituals being told, or routines, skincare routines being told. Korea routine, Kodambakam routine, whatever routine you follow, whatever those, they are not going to help. Unless you treat it from inner, it is inner engineering, you call that word, inner engineering. Thank you.
So, ladies and gentlemen, our next speaker is a firm believer that beauty is an inside job. Dr. Shraddha is a clinical cosmetologist and wellness transformation coach who works at the intersection of science, self-care, and soul. She helps individuals not just to look good, but feel amazing by blending aesthetic expertise with powerful wellness practice. So tell me, who all wants that glow from within? Do we want that glow from within, everybody? Yes or no? We are here for that, right? So yes, ladies and gentlemen, make your pen and papers ready because that's what I'm gonna do. Let's all put our hands together. Welcome.
So good afternoon, one and all here. Thank you for the kind introduction. At the outset, I'd like to thank Venugopal sir, Sivasankaran sir, and the organizers for having given me this opportunity to be here in such a unique event today. So I'm here to talk on procedures in dermatology. After digging deep, I think it's time to be superficial now. So I see more of men here. Just let me take a quick survey before I go into procedures. In this audience here, who is open to doing procedures or who is okay with doing procedures? So it's maybe I would say 20%, even less than 20%. Okay, so at the end of this talk, I just hope that this percentage increases and people are more open for doing procedures. Now, when we see a person who's attractive, we don't sit and analyze, oh, they're beautiful or their eyes are beautiful. We don't go through any examination. It just strikes us within few seconds. Our brain processes it as attractive and otherwise. So why does it happen? It's because of harmony, proportion, and clarity. The importance of being beautiful. Now, this may sound shallow, but I haven't said this. It's been established in studies that more attractive people are more prone to getting better jobs, better placements, better pays than their counterparts, better partners, and so on. So this unfair advantage that attractive people have is called the halo effect. So now let's go into harmony, proportion, and later on I'll talk of clarity. So when we look at a face, so females, the ideal face shape is an inverted egg. So you see most of the attractive people, women, will have an inverted egg shape of a face. For men, it's more of a rectangular face. And also the proportions are very important. Now, if you look at the face is divided into upper third, artists will know this, upper third, middle third and lower third. And it is almost always possible to achieve these proportions with procedures. And proportions, so this is very important. There is a golden ratio called the phi ratio, that is 1:1.618. Now everything on your face is based on this golden ratio, that is your medial eyebrows to the lateral part, or the length of the nose to the breadth, upper lip to lower lip. So various features of the face is based on this golden ratio. And Cleopatra is supposed to have had the perfect ratio. So what happens in aging? So basically there is skin thinning, pigmentation. There's also not just the skin sags, but also the fat, the muscle, the bone also there is a loss. And after the age of 40, we lose about 1 ml every year in the face. So you can see clearly what happens in aging. Now you can see the younger picture, the triangle, the apex of the triangle is the chin. Whereas in the older face, the base of the triangle is the lower face, because the fat pads start to sag. The ligaments do not support and the fat pads start to sag. So now this is the actress Raquel Welch. This was the first picture on the right hand side is when she was 32 years, and the other picture is when she was 73 years old. Now, I think this is what we must know, it's a choice, personal choice, but we can achieve rather. And so who says we don't get better with age? And this was one of the oldest models. She's currently 93 as of March, and she has fabulous skin, she's great, and she looks wonderful even at 93. Now coming to clarity. Now, we can achieve clarity, of course, after the whole, internal well-being. There are certain things beyond which we can do to improve the skin clarity, which is peels for pigmentation. We can do peels, Q-switch lasers, IPLs, pico lasers, and so on. Now, this is one of my patients who had melasma, and we did a combination peel for her, and her pigmentation has improved. Now, this is post-acne pigmentation. After, I think, third session of Q-switch, the pigmentation has greatly improved in a young boy. Now, this girl wanted to get married. She had a birthmark on her right side of the face. She wanted to get this cleared before she starts looking for proposals, and we were able to treat it after about 7 to 8 sessions of. Now, this is another young boy who had a very disturbing pigmentation, and he has tried all sorts of creams, lifestyle changes, everything, sunscreens, the whole works, but it didn't improve. And so he's been very religious. He came about at least 6 sessions. We combined lasers, different lasers, Q-switch, fractional laser, and peels to give him this result. He's still ongoing treatment. Under eye pigmentation is something which is quite difficult to treat. Creams can work for maybe about 20%, beyond which you will have to go for procedures if you want it improved. And causes are different. One is it can be lifestyle causes, or it can be even genetic causes, and mostly it's because of thinning of the skin under eye. So here this patient underwent 1 single session of PRP and it improved. Now coming to textural changes, either scars or rejuvenation. There are various procedures, but we are often made to believe that one cream can remove the scars, and we end up spending on creams. Let me tell you here that no cream actually works for scars, because scars are defects in the deeper layers of the skin, so you will need procedures. And even with procedures, we can only improve the scar, we cannot get rid of the scars. So there are various treatments like microneedling, lasers, MNRF, regenerative medicine like PRP, stromal vascular fraction, which is nothing but stem cells from fat, exosomes, and certain injectables like Profilo. Now, this is one of our patients who had post-acne scars, and she's improved very well with lasers, peels, and the pigmentation also has improved. This is another young boy. Again, I want to put realistic pictures here. This is what we can achieve with treatments. You cannot completely erase a scar. Again, this is a man, he traveled from very far, so we could only do one session. So here we opted for filler to improve the scar. Again, this is another young girl who had some injury when she was a child, and we improved the scar with lasers. Now coming to facial contour. Now you can, as I had earlier talked about proportions, the shape, you can achieve with fillers, Botox injections. There are fat dissolving injections for double chin. Then there is HIFU, high intensity focus ultrasound, RF ultrasound, and so on. Now this is someone known to me. This is how he came when he was in 2016. You can look closely at the jowls, you can look at the nasolabial folds, you can look at his neck. This was in 2016. He said he looks very tired and he wanted to improve the appearance. So every year he comes. He can come only once a year. He's an extremely busy person. And this is him in 2024 December, before I did any procedure in 24. This is him. He won't admit. Now, I was never like this, he will tell me, but this is him now. See, this is what we're trying to achieve. We don't want him to look like he's 40 or 50. You want him to look, all that he wants is, I don't want to look tired. So this is what procedures can actually do. Again, this is another young girl who had morphia of the lip. That is, it's a skin condition where the lip contracts. After medical management for almost a year, we did lip filler, and it kind of improved that appearance. Now this picture is taken from Instagram from a different colleague, and now this is not what we want to achieve at all. This is not aesthetics. This does not look nice. And anybody who suggests this kind of treatment, I think I don't think it looks nice, and I don't know. Our aim is not to make you look a 40-year-old look like 20-year-old. Our aim is to make you look the best for your age. Now, of course, hair is also as important as the skin, and for removing, we have laser hair reductions, which is great for most people, and for hair growth, we have mostly regenerative medicine like PRP, SVF, autologous exosomes, and of course, hair transplant. This is a young girl who had hirsutism. It's nothing but a hormonal problem where there is male-like hair distribution on the face. And this is after 6 sessions of laser hair reduction. This is a young boy who was actually bullied in his office. He used to wear a hairpiece and go to work, and someone pulled it off, and he stopped working. He stopped going to that office, and he came to me to get scalp micropigmentation, which is actually a camouflage procedure. But I told him, no, he can improve his hair growth. We did PRP, we did other treatments, and this is his result. He's very confident now. So now coming to, I've just given you a basic overview of what procedures can actually do. When should you do procedures? Now, age is not a factor. You can do it when you're 70, 80, when you're 20, 30, it doesn't matter. You should do it when you feel the need. When you feel like, no, these creams are not working, something is not, I need to do something more, you can do it. When you are mentally prepared for a procedure, you must do it. And don't let anyone push you for a procedure. You do your own homework, you do your own research, and put your questions down, get it cleared by your dermatologist before going in for a procedure. Always take a consultation, get everything done, and then do the procedure. Now, how to choose where to get your procedure done. Now, this is extremely important in today's times. You look at the qualifications of your doctor. Look if they are a qualified dermatologist. Just an MD will not do. Are they an MD dermatologist? How many years of experience do they have? How many years of experience in aesthetic dermatology is also important. What is the kind of products they are using on you is important. If they're using an injection, they can say Botox, but what kind of botulinum toxin? There are Chinese, there's Indian, there's Korean. You must look at that. What are the kits they are using? Is it US FDA approved? What is the equipment that is being used for you? There are equipments from 5 lakhs to 50 lakhs. So what is the results depend on the equipment as well. So you need to look into all that. And who is performing your procedure? Whether it's a trained technician, whether it's your dermatologist, is the dermatologist giving the settings if a technician is doing? All this is important. And of course, the clinic. Is the clinic run by a certified dermatologist? Does it have a Clinical Establishment Act? You need to look at, does it have safety protocols? Do they have emergency setups? If there is an emergency, is there someone to manage it? Please look at all this before you opt for the clinic. And there is a huge difference between aesthetic dermatology and cosmetology. The beauty industry is a billion-dollar industry, right from products to makeup to procedures. Everything is, it's a booming industry, and you need to differentiate what is aesthetic dermatology from cosmetology. Aesthetic dermatology is proper medical practice, and cosmetology, any unqualified person can do. I'd like to mention here that procedures is not about glamour. It's not only for celebrities. It's for you, it's for me, it's for everyone who wants to look their best. Now coming to pricing, I think this is most important. Procedures are expensive. You cannot have it any other way. You want to look good, you have to spend. And you will need more than one procedure, you will need combination treatments, you will need multiple sessions. So you have to be consistent. You can't expect one treatment to give you results. Remember, if it's too cheap, quality is compromised. Expertise may not be good enough. If it's too expensive, of course, there is a branding component to it. Now, this is one of the ads that was doing the rounds on Insta. A full body laser hair reduction for 6,999. Now, any dermatologist, I think there are a few dermatologists here, they will tell you that it's completely impossible to give a full body laser hair reduction at this rate for a single session. No. If you have a decent machine, it will cost anywhere between 20 to 25,000 at the least. So this picture on the right side is taken in 2020. Now the next picture is 2024, I think, December. Now, why this? So as I was sitting and going through my pictures, and then there was a lot of these apps which generate your AI images. So I said, okay, let me just generate my AI image. This one on the right is an AI generated image of me. So I thought, okay, let me see if I can achieve this kind of a image. So yes, I did. There were procedures that I did. I did fillers, I did Botox, I did microblading, and yes, I did achieve to some extent a semblance to the AI image, but definitely I couldn't beat the AI image. So your expectations have to be realistic when you come in for procedures. I think I finished my talk here. Thank you very much.
Thank you so much. That was indeed a fabulous session. Ladies and gentlemen, put your hands together, please. So yes, dear lovely people, next up, we are going to invite all the 3 skin experts on stage. So ma'am, please join the middle stage, please. Also, we would like to welcome Mr. Venugopal and Dr. Rashmi on stage. So yes, we are going to open the floor for Q&A. If you have any queries, this is your time to shoot it out. All right? And if you have any queries, please make sure to raise your hand so that the mics will be passed. Thank you. All right. So, dear lovely people, are we ready with our questions? Are we ready to shoot the questions?
First of all, thanks to all the 3 doctors for putting together some fabulous one, and especially to Rashmi. You are very young, but you did the best. And thank you for putting it together. So my question is to Dr. Venugopal. You touched about the SPF, and still in a tropical country like ours, still a very largely not understood word. There is a South India where we are talking about different regions requires different kind of SPF, and how does it work? And how to use an SPF first? I don't know how to use an SPF product. Different region.
Sir, you want to know how to use SPF product, right?
So there is a common myth. Some people think that they are in a cool place, say Ooty or Kodaikanal, and they don't want to have a sunscreen because it is cold, it is not hot. Please understand, hot or cold doesn't matter. We're talking about UV radiation. Infrared radiation is something else, where even in a kitchen, women may not be going out much frequently, but more in the kitchen has infrared radiation. So you need to choose accordingly. Do you want to use a physical sunscreen? Do you want to use a chemical sunscreen? What should be the SPF? Would you like it to be oily? Would you like to make it dry? For example, the same customer would like to use a dry sunscreen during summer. Why? Because his skin will be a little bit oily. Because our skin also changes with the weather, with the climate. So then we have a problem. You need to change accordingly with the times. And what was suiting you before may not necessarily suit all through. The same brand, same ingredients all through. So that requires a careful, personalized prescription. There's no one size fits all. You need to decide. That's why there is a dermatologist. let the dermatologist decide that.
Thank you. And yes, for the same Q&A, we are going to invite someone very special. Can we have Mr. Sivasankaran to kindly join us?
All the technical questions, please ask doctor, sir. Only biohacking questions ask me. Okay? Yeah, please.
Does air quality has an effect on the skin, and are air purifiers necessary for a good skin?
So yes, definitely the air quality has effect on the skin. If there is more pollution, you have more reactive oxygen species, which does damage the DNA of the skin.
Yeah, air quality also, other than that, I was talking something about it, I never completed it. See, suppose you go above the sea level, the more higher you go, more UV radiation. So that only means that most often what happens is when you go to a colder place, for common people, let us think about Ooty or Kodaikanal, they go up. They don't usually use a sunscreen because they feel it's cold, there's no need for anything else except for a moisturizer. It's actually the reverse. When you go higher up, you need more UV protective sunscreens. And sunscreens have to be used regularly, consistently, at least once in 2 hours. You need to apply 15 minutes before you go out. These are all factors. There are sunscreens which work for longer duration, say up to 6 hours also. But you need to be careful and you need to read the label well, because there will be sunscreens which will say it can be used during swimming also. But then how long? Most of it will not work for more than half an hour. So you can get fooled by it. So you need to be careful. The best thing again to do when you don't know, to see that your preferred dermatologist.
Yes, sir, please.
I am Dr. Karthik. I am an avid swimmer and I am fitness enthusiast. I was fortunate enough to meet Sivasankaran sir in the swimming pool once. And then he suggested to me that join the Aiwo team. And since then I've been under his guidance. And me being a doctor, I learned a lot from him. And he really helped me. My question is to Dr. Shraddha. Like, I am 60 and I maintain myself reasonably well. The thing is, of late, my eye bags are increasing. I hear a lot about these actors and everybody saying that you can have injections to camouflage the eye bags to some extent. Or
Yes,
something
sir.
like you can also have a blepharoplasty.
Yes,
So those
yes.
things they say. I mean, I've
Yes.
read it in the literature. So I
Yes.
just want to know really those things work, and if so, what will be the cost?
So yes, sir. So the thing is, if it is a SOOF, if it is an under eye fat pad that is there, fillers can only support, it can only improve. The best would be to do a blepharoplasty by an oculoplastic surgeon. Yes, sir, the procedures are expensive. I don't do blepharoplasty. You will have to see. But if there's a tear trough, that is a depression, then fillers will help, definitely.
Okay.
So we need to examine to see whether fillers will work or bleph will work.
Thank you very much. Yeah.
Madam, what do you think? What do you three people think about the wonder peptide or something which has come? What do you think about ceramosides?
Yes, sir. Ceramides are normally present in our skin. So those with dry skin, giving a ceramide moisturizer definitely works, especially those with dry skin, atopics, those who have a defective barrier. Yes, ceramides are wonderful.
I have a question to Sivasankaran sir. How do you reduce the IgE level? Because it affects both the skin as well as the other parts of the organs.
IgE, you increase your antioxidant level and reduce inflammation. Remove the cellular inflammation by taking 4 grams of omega-3. Don't use seed oil. Take 25 ml of high polyphenol olive oil, either from Australia or from Portugal. From the olive tree to making oil should happen within 90 minutes. Okay? That oil, 25 ml, don't cook. Take a cooked food like idli or pongal and pour it, or just take the oil. In 90 days, you will improve your IgE.
Thank you, sir.
Hello. My question is to the doctors. Facial yoga is in trend now. There are a lot of facial yogas which is coming up, and I would like to understand, is it going to firm the skin or is it going to worsen the elasticity?
One thing I am sure, it will bring down your bank balance. But I will explain you. You can either do hydrofacial or you can face laser facial. Okay? Occasionally using that is good. In fact, if you don't have a cooperative husband and wife, you also do a back facial. Most of the people don't understand the back of your back. If you take a small cloth, put it with the cleanser and rub it, you will see a lot of particles, exfoliation. Okay? That helps to reduce your C-reactive protein. So that nowadays people who go for heart operation, hospitals like Apollo hire people to put the soap in the back and clean actually. They do the cleaning. After I spoke to Sunita Reddy, everybody, they are getting clean now.
Something that I've commonly seen in my friend circle and myself also is a condition called PLE. And most of the time we try to apply or reapply sunscreen every 4 hours or 2 hours or have this sunscreen jackets. What are the other things that I can do to internally help myself control the spread and subside the eruptions?
Whatever said and done, if you're talking about polymorphous light eruption, then you need to treat the root cause. The root cause is again sunlight. Without protecting yourself from sunlight, let it be physical protection, which I mean by using either umbrella, hat, or avoiding sunlight for that matter, and then still you need to put a sunscreen. Please understand that sunscreen is not a license for you to get into sunlight. It is not that way. Sunscreen will protect you. You put SPF 50, which is considered it will protect for 50 times more than the other person who's not using a sunscreen. Still, it does not perfectly protect you. You need to still follow physical measures of protecting yourself from sunlight. Then comes the question. I'm giving an additional question. Once a person is treated for this, how long you can treat? You have a problem, and this problem has come up now. But this polymorphous light eruption problem is again cellular inflammation that is happening. The trigger is UV radiation. Lifestyle medicine, followed by drugs, along with you have to quench that. I was talking about anti-inflammatory drugs like omega-3, curcumin, and there are a lot of supplements which can reduce it, including vitamin C. All of these things will help, but it all takes time. Only thing that works faster than medicine is poison. So you need to wait to get the results.
And the sunscreen, choice of sunscreen is very important. If OTC sunscreens you may think you're using will not be effective at all. So please take that sunscreen to the dermatologist to check if it's actually an effective one.
Also something about sunscreens. A few dermatologists that I visited told me that you have to look for sunscreens that have zinc in them. What's actually the theory behind it, and what should we look out when we are purchasing sunscreen?
So the UV radiation is actually UVA, UVB. Okay, UVC does not reach our skin. So for UVA, you need a physical sunscreen, which is zinc oxide or titanium dioxide. Only these two can protect against UVA. UVB is where your SPF comes into the play. Okay, so you measure so UVA sun protection is the stars or critical wavelength you have to look for. In UVB, it's the SPF.
I have seen many clients, I'm a cosmetologist and a PMU elevator, so I've seen many clients with hyperpigmentation and melasma doing clinic hopping. That is, they are being to many clinics, but still they are not getting appropriate results what they're expecting. It is not able to be reversed even after they had done peels, lasers also, and they're seeing whether any chances would be there from our side to help them. In that case, like, is there any way to forecast that this type of skin could get the melasma, or any starting stages where we can identify and rectify it in the beginning?
So see, there is no way to determine whether, of course, there are genetics, there's hormone, OCPs. These are triggers that can cause melasma, but we can't really determine who will get melasma, who won't get melasma. But the best way is to start with sun protection, strict SPF, and a good quality of life, so that they don't, the chances of developing melasma is less. And once they get, as you treat it as early as possible, the chances are better, because melasma, there is superficial and deep type. Once you get the deep part component, you can't get rid of it with creams or superficial procedures. You will need deep peels.
Thank you, ma'am.
See, in short, what Dr. Shraddha wanted to say was, if it is only epidermal pigmentation, the story is different. You can do it better. If it is deeper, it is actually very difficult even with the best treatment possible. The reasons, you need to look at the reason. It's hormonal. You need to treat the root cause basically. Only then the rest of it will work. Lasers are not a panacea for everything.
And lasers don't work for melasma, by the way.
Fantastic. So thank you so much, ladies and gentlemen. A huge round of applause to all the doctors on stage. So I'm sure you must be having a lot of queries yet, but make sure to mail that to Aiwo, so we will reply you at the earliest. So yes, doctors, please do stay back. We would love to give a small token of love and appreciation. Can I request Mr. Sivasankaran to kindly do the same? Ladies and gentlemen, a beautiful bouquet and memento coming up for our guest speakers. So